I was really pleased that this session was placed first in the program because it really is going to demonstrate what can be done and what's being done. This session will feature state and local governments and institutions that have successfully implemented policies to reduce the availability of sugary drinks both to employees and the general public. You will hear about the successful experiences of 2 city health departments, 1 state, and a comprehensive medical clinic on how they have implemented policies to reduce sugary drinks. In Boston, they phased out the sale, advertising, and promotion of sugary drinks on city-owned properties, including vending machines, cafeterias, concession stands, and beverages served at meetings, city-run programs, and events where city dollars are used to purchase beverages. In Los Angeles, which was one of the first school districts in the country to eliminate sugary drinks in school vending machines, that was in 2004, the county now requires 100% of foods that are sold on government property and vending machines that they meet the California nutrition guidelines. In Philadelphia, they've run successful advertising campaigns to raise awareness about the health effects of sugary drinks, and they've also limited sugary drink serving sizes and their placement in vending machines on city property. In Cleveland Clinic, which is a highly respected academic medical center, in 2010, they've removed sugary beverages, and that includes soda, iced teas, lemonade from the cafeteria vending machines, as well as the cafeteria and patient meals. So our speakers today will be Giridhar Mallya, who's Director of Policy and Planning at the Philadelphia Department of Health, Persis Sosiak, who's Director of Public Health and Research at the Cleveland Clinic, and McHugh, who's Director of Chronic Disease Prevention and Control at the Boston Public Health Commission, and Paul Simon, who's Director of Chronic Disease and Injury Prevention in Los Angeles County Department of Health. So each speaker will present for about 5 minutes, just really giving an overlay of what their policy is, and then how they've implemented it. And then we're going to hold questions and comments until after the 4 speakers. And then we'll have a discussion among all of you. We want this to be interactive, so you can really hear their stories on how they've built support for policy changes, what obstacles and opposition they faced, and how they actually implemented the policy and lessons learned. I've kept the introductions short because there's descriptive bios in your book about each of these, and we're going to start out with Giridhar.
Good morning. Glad to be here in Washington, D.C. with such a great group. Rode down on the train this morning with Mayor Nutter. He is very, very excited to be here and really hear and learn from all of you folks that have been doing work around the country to raise people's awareness about the health effects of sugary drinks and really think strategically and creatively about how to reduce Americans' consumption. So I'm going to talk very briefly about 3 strategies that we've tried to implement in Philadelphia. So those include vending policy changes, 2, our media campaign focused on sugary drinks, and 3, tax-based approaches. I hope there is good discussion and time for questions as we finish our presentations. So we've taken a holistic approach, much like many other cities and communities, looking at all the different sectors within which we want to achieve policy and systems change. And what I do actually really need to say is we've learned a ton from other communities and other cities, including Boston and Los Angeles, And I think one thing that maybe has not been talked about enough is how much collaboration and sharing of knowledge has been going on across the country, particularly within large health departments. And I think the way that we've worked together may be a model for future collective and collaborative public health action. So I'm going to give a couple examples of what we did in these sectors. So first with vending, like with other cities, we took all the beverage vending machines in City of Philadelphia buildings, offered more healthier choices, put them at eye level. The sugary drinks that remain are 12 ounces or smaller. We have calorie labeling on machines. And I think maybe a particularly important thing, as we were going through discussions about the sugar-sweetened beverage tax in 2010 and 2011, right outside of city council chambers was a big Coke machine that featured Coke as the product, and it was sort of a big red box. That machine is actually shown on the slide. So not only did we make the changes in terms of mix of products and size, but the featured product on all the machines is now water. A couple key lessons. I think the vending companies want to keep your business, so they will find ways to work with you. And I think governments and other large employers have a lot of leverage in making these types of changes. Two, we also took this as an opportunity to make energy retrofits and or energy upgrades to our vending machines. And we were actually able to achieve about $100,000 in energy rebates and energy savings. So it's just a way of combining a health initiative and a sustainability initiative. We have worked a lot on disseminating this policy to other large employers, and now it's probably closer to about 100,000 employees, both in the public sector and private sector, hospitals, insurance companies, other large employers that have implemented similar policies. Media. There have been a lot of communities that have developed and tested media campaigns focused on sugary drinks over the last 2 years. We have tried to be very careful both about doing formative evaluation, and I see a colleague here from Penn who helped us with that, and also looking at the impact of our campaigns. Since there aren't many campaigns focused on sugary drinks, I think we want to know what works and what doesn't work. So we interviewed 500 parents, caregivers of young children, before the campaign. We really wanted to focus on parents as they help set the way that kids think about beverage consumption, and two, they really, in some ways, control what's consumed in the home. So here's what we heard. We heard that most parents don't think their kids are overweight or obese. We heard that they are concerned about sugary drinks, but they continue to underestimate how much sugar and how many calories are in them. 3, we heard that they're concerned about obesity, but when they learned that kids are now developing the type of diabetes that only adults used to develop, to a person they said, that makes me want to do something different. And then lastly, they wanted to feel empowered by the messaging. So we really tried to incorporate that into our media campaigns. We are going through our final evaluation after the 15-month campaign has been airing. It's been on TV, radio, transit. We're reaching the audiences we are hoping to reach, so there's been good recall of these campaigns. And this is a busy slide, but what it shows is that over time, people are recognizing that there is more sugar in sugary drinks than they thought at baseline. We're also seeing some promising findings with regard to people linking sugary drink consumption and weight gain and sugary drink consumption and diabetes. So more to come. Lastly, and I'll finish up, we did introduce a tax on sugar-sweetened beverages in both 2010 and 2011. This chart just gives you a sense of how they were similar and different. So both years it was 2 cents per ounce. I think the big difference is that it was a gross receipts tax that would really be levied on retailers in 2010, and that was because of legal limitations that we thought were in place. But in 2011, we realized that through local taxing authorities, we could have an excise-like tax that would be levied on distributors or dealers. And then also importantly, the money in both cases would go towards, at least some of it, health promoting and obesity preventing activities, but there were other revenue related needs in both years. This has been the response of industry nationally to a variety of policy initiatives, including taxation. I think we saw just about every single one of them in Philadelphia. The picture in the upper right-hand corner was during an anti-soda tax rally that was right outside of City Hall. There were hundreds of Teamsters who are the folks that drive a lot of the beverage trucks in Philadelphia. There was direct mailing, direct calls to Philadelphians, and this was all done through these AstroTurf organizations, things that seem like they're grassroots, but they're actually not. They're funded by the beverage industry. I'm not going to go through the chronology of the two taxation approaches, but I want to just highlight a couple of the things that we learned. This is really hard to do, but if you can match the political timing and the public health timing, I think that's key. You need time to develop people's awareness about this issue and their support for such an approach. The structure of the tax really matters, both in terms of public health, but also in terms of how people are going to respond. If you can minimize the impact on small businesses and try to have the tax applied at as high a level as possible in the distribution chain, that's important. Don't just talk about obesity. As I said before, really focusing on diabetes is important. People in Philadelphia and around the country, unfortunately, probably every single person or close to it has an uncle, a sister, a loved one who's been affected by the disease in a really profound way. How the money is used is important, both in terms of public support and also being able to explain, what are you going to do with all that money? These taxes, when they're at 1 cent per ounce or 2 cents per ounce, would bring in a lot of revenue. And I think the public has serious questions about what government would do with that much new revenue. Community support is important, and the beverage industry won't stand for the status quo, and I think they really did feel threatened by these initiatives and others. But as you'll hear from the mayor later today, you have to be persistent, and I think that's something that he has shown in his career in public service, that you may not be successful the first time, but you need to keep trying. Thanks very much.
Good morning, everyone. Thank you for this opportunity. I have to say that Michael not stole my little bit here, but as a fellow Midwesterner, you will forgive me if I break into pop instead of soda. So soda we don't hear much in Cleveland either, but you'll know what I'm talking about. So just a very, very brief background on the Cleveland Clinic, if you're not familiar with us. We were founded in 1921. We are the largest employer in our region of Northeast Ohio, but we also are the second largest employer in the state of Ohio, and that number is really about 40,000 physicians, nurses, support staff from all the sectors. So we do occupy a large market share in the state of Ohio, but also in Nevada and Florida. And if you've been to our, though I'm the only healthcare facility represented here on this panel, if you've been to our campus, sometimes we also seem like a small city. So some key dates to share with you on our journey to reduce and then eliminate sugar-sweetened beverages. In 2007, it was determined that the content of sugar-sweetened beverages in our facilities would be reduced by, that 70% of food and drinks would be no sugar added. That was a part of our journey. Then in 2010, all sugar-sweetened beverages, as also Michael alluded to, were removed from our cafeterias, from our vending machines, as well as from any patient menus. This is not at all endorsing any product, but it just shows that these are some of the selections that are now available in our facilities. We have approximately 47 food vending locations or food service centers that encompasses a typical hospital cafeteria, a small, just a little, like a caddy where you can get some foods. So a variety of settings, but again, no sugar-sweetened beverages. We also have right now 300 or so machines where you can purchase, so vending that includes both beverages as well as snack food. The one that we're still determining is the actual just cold vending machine, just a pop machine, if you will, because many, given the size of our facility, there are many hidden vending machines that are tucked away. I know when I was practicing as a nurse, we had the now contraband pop machine on our break room that was highly sought after, but those are being tracked down and changed. So the question becomes, well, how did this work? So our leadership has been key in making these changes and in supporting them. Our CEO is Dr. Toby Cosgrove, and he is very committed to a culture of wellness, both for our patients as well as staff and those people who come to our facility for any reason. One of his mantras that you may have heard is that we should not be practicing sick care, but we should be practicing well care. So his philosophy, which imbues really our whole environment, is that we have to be good examples and good stewards of what it means to be healthy. This is just a timeline because I think what we've done with sugar-sweetened beverages is just one example of, again, this entire commitment to the culture of wellness. We started 2005, 2007 with looking at tobacco, both on our campus and then among those that would want to be employed with us. We moved, there was an elimination of trans fats in 2007. We now have farmers markets. We have programs that are free to our visitors and as well as our staff in terms of Curves, which is, that is national, but it's a gym for a female type workout facility. Weight Watchers is available as well. We have yoga throughout the day. And most recently, because we are a self-insured facility, our healthcare premiums are also now tied, if you choose, to ways in which you participate in wellness activities. And I'm, again, proud to say that I'm wearing my pedometer, which everyone or many people at Cleveland Clinic wear, again, just to keep proving how important it is to really model the behaviors that we are supporting. Just as I showed you the change to our beverages, our vending machines were also transformed. And again, this is not to advocate for any particular brand, but the joke is that when the mid-afternoon munchies hit at the clinic, you can't get a Snickers, you can't get a soda pop, and Dr. Cosgrove will frequently say that he himself was the most impacted by this, but we all learn to adapt, and that's making our environment and our visitors clearly more healthy. So I will just wrap up very quickly. This is a very interesting concept, and I know others have these, other cities, other healthcare facilities, but we also have farmers markets that take place throughout our rather limited growing season in Ohio. And the beauty of them, though, is that they're open to the entire community. So we have people from all of our neighborhoods, our patients, our families, that are all able to come. And actually, yesterday was the first day of the market, but I think it really proves how we are living this culture of wellness, but then trying very, very diligently to impact that to our broader community and our neighbors. I'm happy to answer questions at the end. Thank you.
Sorry, everyone. Oops. Okay. Good morning, everybody. So just to add to the taxonomy of what we call sugar-sweetened beverages regionally, I'm from Boston, which everyone always knows as soon as I open my mouth. But when I went to college, everyone wanted to know what was this tonic that I talked about drinking. And I guess that's a very small micro area terminology that actually I read recently is on its way out. It's hard to find young people in Boston who know what tonic is, except as it goes with gin. Which is another story. I just want to talk briefly about our efforts to build public awareness about SSB consumption, and then about some of the policy work that we've done. So And I want to just reference this in the context of what you and communities can think about taking on. Depending on the amount of funding, you have more limited funds and then more generous funds. So when we first started wanting to really build some awareness, we didn't have very much money, and we looked around, and I really want to give thanks to our colleagues in Alameda County and other Bay Area county health departments in California, because they were working on this soda-free summer challenge. And so we took that on in 2010 and 2011. And we provided a lot of education workshops to camps and summer youth programs. And we used social media and a little bit of money on cable TV to promote taking the challenge to either cut back or eliminate SSB consumption for just the time of the summer. But we also tied it to organizational pledges to reduce the availability and access to SSBs. And we actually got about 70 organizations to sign on, as well as the individual pledges. And we got a lot of good earned media about this. Then we were fortunate to be recipients of the CDC's Communities Putting Prevention to Work grants, and we did two large community-wide campaigns in 2011. And this first one is targeted to youth. The tagline is "Don't get smacked by fat," and the TV spot has a glob of fat coming out and smacking, a kid walking down the street drinking an orange soda. Dr. Oz tweeted about this campaign, saying it was gross but great, and we got 20,000 hits that day on our website, which, was wonderful, and it kind of made us realize our efforts sort of are dwarfed by these big-scale celebrity efforts, but they're great to try to engage with. We then also targeted parents of young children, and this campaign has the tagline, "You do so much to protect them," and it really tries to draw on the desire of parents to protect their children from harm, and it builds on the injury prevention concept and then moves to, and here's something else that you may not be aware of, i.e. serving your kids sugary drinks. And we are evaluating each of these campaigns. The other thing that we've done, both for awareness and as a decision prompt, is developed what we call the traffic light signage, and we developed criteria for red, yellow, and green beverages, where red is faux sugar beverages, yellow is diet and some 100% juice, and then green beverages are basically water and low-fat milk. And we now have this signage at more than 100 points across the city, and we're continually filling orders for this. So then we've moved on to working on policy changes that we can make in the city. So we had worked back in 2004 to remove sugar beverages from the vending machines in our school district, Boston Public Schools. Then we have worked with a city agency that runs about 40 community centers across all the neighborhoods, the Boston Centers for Youth and Families. And they implemented in all of their summer programs, where they also contract with 50 other organizations, a healthy beverage policy. And that began last year, and it is continuing. And that's written right into the contracts, that they cannot serve unhealthy beverages. And that's also had a lot of impact in terms of all these small youth organizations then requesting more information about how they can reach their youth and parents with further information about this as a health issue. And then this past year in 2011, our mayor, Tom Menino, issued an executive order to ban the sales of SSBs in city buildings and surrounding property. So this is an executive order. It sort of can be issued unilaterally. It applies to the whole executive branch of city government. There are healthy beverage standards, which are actually based on the red, yellow, green criteria that is set. It applies to vending, to city procurement, and to city-sponsored events. So it calls for no full sugar red beverages. It does allow for yellow beverage diet drinks that are supposed to be no more than 1/3 of the total available, and milk must be 1% or fat-free. We've also restricted the graphics on the vending machines, as the Philadelphia photo was a great example of. And we've restricted promotions on city property of events that include sponsorship and showing any full sugar beverage. I have to say this has been an area of interesting dialogue, because we are not prohibiting beverage companies from doing sponsorships where their general logo might be shown. And as you know, for some of the soda companies, their general logo and their full sugar beverage logo are one and the same. And that's a continuing issue. And the other thing that we see is a lot of beverage companies coming in, wanting to do work on promotion events on city property, and now promoting their diet beverages. So I think that the beverage industry adapts to the policies that are in place. I also want to reiterate that though the vending companies, they have a lot of offerings. They're very willing to work with whatever criteria are being put out there. The next effort that we're still engaged with is a hospital healthy beverage learning network. So this is partnering with the 10 major Boston teaching hospitals, and we've asked them to come together in a network where they go back to their hospital, they have a work group, they are developing individualized approaches to decreasing access through pricing, signage, stopping sales. Each of them has their own work plan, which varies. The Learning Network provides technical assistance, best practice sharing, and training. Healthcare Without Harm has been an amazing partner with us in this effort, and I credit them with a lot of the success that we've had. And American Heart Association has also been a great partner. To date, we've been doing this for somewhat more than a year. All 10 hospitals have publicly committed to changes. We had a press event a couple of months ago in Heart Month to announce it. In the wide range of approaches, it includes one hospital that completely removed sugary drinks right at the beginning of the effort. Point of decision signage, the red, yellow, green labeling is very commonly used. Choice architecture in cafeterias, and removal of the sugary drinks from patient tray service. And I also want to say we had one of your colleagues from Cleveland Clinic who did a conference call for us, which was very helpful about the great work that you did. And I think bringing the hospitals together and having the peer pressure of them with each other, it has been, as well as just the learning and the complex problems that they have to deal with in terms of this, has been a really, I think, strong way to go forward on this. I think that our overall lesson in Boston, where we've really striven for both municipal and private organizational kind of voluntary change, is that the more partners who are working on this from different sectors of the city, the more traction you get. I think that Mayor Menino, who is a huge champion of public health, found that he had more space to be able to make the executive order in the city, because we could also say that healthcare was leading the charge on this, and that there was already a hospital in Boston that had banned sugary drinks. And then his actually issuing the executive order then helped to push the other parts of the hospital and other sectors to say, well, we really need to be leaders in this too. So I think you can bring the different pieces together in a way to get an upward spiral of traction on the issue. Thank you.
Morning, everybody. I'm Paul Simon with LA County Department of Public Health. Can you go ahead and put my slides up? I wasn't going to use them, but I think I'll use some of them, if it's okay. Giridhar mentioned the importance of the partnerships across the country, which I would definitely agree. We've all benefited from that. But it's interesting, there are 3 of the 4 panelists are from health departments, and I would say the success in Los Angeles County and California to a large degree has resulted from partnerships outside health departments. Community organizations have been critical. I see in this room representatives of some of the key partners for us. California Center for Public Health Advocacy, California Food Policy Advocates, Berkeley Media Studies Group, Public Health Law and Policy, now called Change Lab Solutions. So it's really a panoply of different partners that have helped us. One of the distinct features of LA County, I think, is its size and its complexity. 4,000 square miles, 10 million residents, 88 cities, 81 school districts, and a large unincorporated area. The curse here is that it's hard to get jurisdiction-wide impact on policy. But the blessing, I think, is that it's a nice laboratory. There are lots of policy-making units, and we can incrementally, I think, see progress. Just, I think, a positive message. This is a really important paper that was published by 2 folks at UCLA that I think has not gotten enough attention, but it showed a very significant decline in sugary beverage consumption from 2003 to 2007, and a decline in obesity prevalence that paralleled the decline. The groups that had the biggest decline in SSB consumption had the biggest decline in obesity prevalence during that period. But nonetheless, we still have high levels of SSB consumption in our population. As I think was already mentioned, back in 2002, we began to see progress in the schools. LAUSD, our very large school district, made a bold move to remove sugary beverages from campuses despite fears about loss of funds. And that then progressed to state-level legislation, a K-8 soda ban in 2003 that was extended to high school in 2005. And about 6 years ago, we in the county began working on a vending policy, and I think there's been, upon reflection, tremendous norm change, because I remember at the beginning it was like pulling teeth. I mean, there was incredible resistance, and what we ultimately got approved was a very timid, phased approach, which we did for several years. And it was interesting, the vendors actually told us that they would prefer all or nothing. It was hard for them to calculate what's 20%, 30%, 40%. So that made it much easier to move more recently to 100% policy. On the beverage side, our vending policy has mandated that if there are beverages offered in the machine, there has to be water, and it has to be priced so that it's no more expensive than any of the other beverages. We've allowed diet drinks. There was a lot of debate about that, and ultimately we felt that was an area where we could give. But we didn't completely eliminate sugary beverages, but a sugary beverage in the vending machine has to have less than 25 calories per 12 ounces. But just to highlight the importance of enforcement, and this is really for us a lesson learned, you have to I think, invest as much or more energy in the implementation as you do in the policy development. And this was a photo that was taken in one of our public health centers that shows water priced at $1.25 and soda still in the vending machine priced at 75 cents. The Communities Putting Prevention to Work initiative has really allowed us to accelerate our work. The policy change work takes a lot of resources and effort. Working with our partner, California Center for Public Health Advocacy, we very quickly have accelerated the work to 10 cities and counting. More cities across the county are interested in passing vending policies. In addition, in March of 2011, our County Board of Supervisors passed a motion that we felt was very, very important. It requires all of our county departments, there are actually 37 county departments and about 100,000 employees, so it's very, very large, requires that any of them that enter into a food services contract must consult with the Department of Public Health to insert nutrition standards into the contract. With regards to sugary drinks, what that has included is portion size limitations in cafeterias, for example. We've now gotten written into the contract that the sugary drinks can be no larger than 12 ounces. And it's interesting, that seemed to fly without much resistance. But I think if we tried right now, given our political climate, to do something, the great things that are happening now in New York City, we would meet a tremendous amount of political resistance. In addition to portion size limitation, there have also been some pricing components as well. Again, the beverage can't be more expensive than the water. I'm sorry, the water can't be more expensive than the beverage, sugary beverage. And then finally, I just want to talk about our media work. Much of this work could not have been possible without the Communities Putting Prevention to Work funding and now the Community Transformation Grant funding. We've rolled out a sugar pack campaign. It was informed by focus group testing that we did early on that showed that many of our communities, and particularly ethnic populations, had very limited understanding of how much sugar is in these drinks. They were truly shocked when they learned. And in fact, many were introducing soda and sugary beverages into their children's diets at a very, very young age, under age 2 even. And so we designed the campaign around this, and you can see here, essentially it's the tagline you can't see there, but it says, if you wouldn't eat 22 packs of sugar, why are you drinking them? And we've shown these on transit TV, on bus stops, on buses, in subways, in metro stops. We're currently out in the field evaluating the reach and impact of this media effort. And I just want to close, actually, by talking about our next steps. We've made a lot of progress in the public sector, but we want to expand that work into additional cities. We want to intensify our public education efforts. We feel that by educating and creating consumer demand, we can accelerate the policy work. And finally, we want to expand our efforts into the private sector. That seems to be the biggest nut to crack, but we've begun some initial discussions with supermarket chain operators and with restaurants, and I think a big focus is going to be around portion control. Thank you.
I think it's on now. Okay, this is really inspirational, I think, in what can really be done at the local level. I was wondering if any of you are working with your states also on having more statewide policies. I mean, all of these are really at the local level.
We do work with our State Department of Health on a variety of issues. I think where it's come in most handy is that the state is really thinking a lot now about how they can move maybe away from doing traditional programmatic work and thinking more about policy and systems change. So I think we've shared in that way. There are other, there's a new community in Lancaster, Pennsylvania, a rural area that's about 2 hours outside of Philadelphia, that's a grantee through the Community Transformation Grant Program. So we've been sharing a lot of information with them about our successes and failures.
In California, that has really been important, and the California Center for Public Health Advocacy always emphasizes this in their work, that the locals are sort of the laboratories of innovation, and you start to build momentum, and that then leads to state-level action, at least in California. And the state has in the past provided technical assistance, and we certainly have shared a lot of our media work so that we're communicating common messages.
In Massachusetts, we've provided some technical assistance to other communities that are interested in addressing SSBs, and a number of hospitals from other parts of the state have actually have taken our stoplight signage and are connecting with the other hospitals on how they can implement policies.
I can just add that Cleveland Clinic was involved in a bill that went through our General Assembly 2 years ago, primarily focused in education, but it was, there were definitely restrictions on sugar-sweetened beverages, but that is now under attack. I just learned yesterday. So we'll see if that language changes at all as our Assembly seeks to go into summer recess.
I'd like to invite people also to come to the mic. There's 2 mics, one on each side, so that this can be interactive and we can hear from all of you. And so when you do speak, if you could also just identify who you are. What were some of the obstacles that you really faced? And was there backlash from the employees? You know, because oftentimes that can really curtail any type of progress. How did you deal with that and build support so that you could overcome that?
So in the implementation of the mayor's executive order, well, I think that the backlash is from media, you know, kind of the blogosphere on the nanny state, the why is government doing this, you know, some misinformation put out about, you know, you can't have a soda at your desk or in the lunchroom. Well, you can brown bag in anything you want. That, you know, you wouldn't be able to walk down the street with the soda because that's city property. And so I think there were some minor lessons learned about, you know, the messaging when you put out your policy, to just be clear and speaking about it. But that backlash has not been as great as we had anticipated that it might be. There's some disgruntlement amongst city employees, I think, but most of them are working in places where, quite frankly, they can go to the corner store and get an SSB. And but there's been a lot of also support from people speaking out about, you know, their own efforts to make change, and how having an environment where you're not constantly being marketed to you know, to drink soda is a healthier environment. And the mayor has been very firm on it, so it's mainly gone pretty smoothly. I think that working with other organizations about their policy change, you know, it's really variable. And you can speak to this much more than I, but I think hospitals are 24/7 organizations with a lot of complexity, and we found much more speaking to the hospitals that a number of them just have a hard time seeing how to get over the issues, and a number of them have had a lot of employee backlash.
Well, we did, but it's, again, because of the way that our environment has been shaped. I think that, I know many people in leadership got angry letters. There's been our similar, you can't control everything I do. You say where I can smoke or if I can smoke. So it's similar. Now you're saying what I can drink. But I think overall it was fairly low in terms of the resistance. I did hear that sales went down about 30% in our beverages over the first 2 months, but then they came back, and now if there's any loss, it's negligible. So I think it's just, in our case, we had strong leadership that just said, this is what we're doing. And similar to the other experiences, both our city of Cleveland and our county is also on a somewhat of a similar trajectory. So we are, while trailblazers, we're in a very common environment now.
One other quick thing I'll note is that, we heard from a lot of folks both before and after our policy was implemented that it was the water and the non-caloric drinks that often weren't available when they wanted them. So it was just empty in the machine. So seemingly we weren't meeting demand. So just by having more options, more of the buttons be for water or non-caloric drinks, it was being somewhat responsive to what the consumers wanted. And then I think tracking how sales and potentially consumption patterns change and providing that information back to employees is important as well.
I just wonder what's happened to the drinking fountain. It's amazing. We're so great in technology, but it's so hard to find a drinking fountain with cold water. I would love to talk to a sociologist about how social norm change happens. I'm not quite sure how or why, but I see it happening. And I think about what's happened in New York City, and I have to believe that the next time a policy is proposed like this, there will be less of a backlash. There'll still be a lot, but it'll be a little bit less. And I think it requires repetition. Mm-hmm. And through our social networks, as we just gradually become more comfortable with these sorts of policies. Because at the beginning in LA County, I think the resistance came from some pretty surprising quarters. Even staff in my own division weren't happy about it. And now, as we propose at least vending policies, much less, very limited resistance actually, except from the industry.
I was just told instead of going to the mic that if people want to just raise their hands, that they'll bring the mic to you. So Shariki?
Thank you. So I'm Shariki Kumanyika, here today for the African American Collaborative Obesity Research Network, University of Pennsylvania. The question, these are great examples, and I'm thinking about the Institute of Medicine report that was just released earlier this month, and wondering if any of you are trying to do a systems-based evaluation of what's happening, either a qualitative, any kind of a retrospective, to see how this may be splaying out into other aspects of your initiatives.
Did you write that? Were you one of the authors of that report? Yeah. That's a very, very thoughtful question. I think the one word that threw me a little bit was a systems-based approach. And I think we're going to have to think a bit about that. We are doing a fair amount of evaluation, but everything is moving so quickly that my sense is we're doing probably evaluation that's a bit too compartmentalized. And so I'm going to have to think about how we could do some work, evaluation work, that would be more systematic. That's right. A good point.
If I can, since there's not a groundswell of people here from the floor, the IOM report really talked about doing things in like 5 different areas, and the ability to accelerate progress is really going to depend on a synergy, kind of a mutual reinforcement among those areas. And this is, I mean, you've made such progress in the different areas that it would be great to see, for example, with the Black community and some of the campaigns, can that awareness support other types of initiatives? You know, would the parents then know that and would they go to schools and so forth? So really thinking about systems report, I'm sure any of the authors of that report, including Tony Aitan out in California, will be happy to help you figure out, you know, what to think about.
One thing one thing that makes me think of, Shariki, is that, so with two things, actually. So with some of our programmatic interventions that are happening in communities, our Healthy Corner Store initiative, for example, we try to link that really closely to schools and other child-serving institutions. So trying to find a way to make change in both those settings, because those are the places that kids are being exposed to, either while they're being educated or as they're going to and from school. I think the second thing that it makes me think of is that we focused on caregivers for our media and education campaign for the reasons I said in terms of how they shape norms in homes, how they shape purchasing decisions. But in many ways, those folks are also informal or quiet leaders within communities, and I think they really can drive public opinion. And we heard that a little bit the first time around with our tax proposal in 2010. It was often parents that were the first ones that came to us and said, you know, I may not support this, but I get why you're doing it. And I think we wanted to make sure to reach that audience in particular with additional messages and information so they could then disseminate that to not just their own families, but to people in their communities.
Okay, hi. Jim Krieger from Public Health, Seattle and King County. Thanks for an awesome panel. You guys are so inspiring and really appreciate all the work you're doing. So I had two questions for expansion of the work to see what you guys are thinking or recommendations. One, as Paul mentioned, is reaching out to the private sector. And particularly I'm interested, Persis, in talking about employer wellness programs. Many employers contract with wellness vendors, and I don't see a lot of SSB messaging going on through those employer wellness campaigns in terms of they set goals for how many minutes a week might you exercise. They don't set goals for how much less SSB might you do. And also providing on-site consultation to employers about getting rid of SSBs from vending and cafeterias. So I'm wondering if that's an area worth exploring. And the second is an area that's near and dear to CSPI's heart because they're leading it, is the supermarket arena. And I think, Paul, you alluded, and Giridhar, to potential local work going on there. We know that 45% to 50% of all SSBs are sold through that sector. And so if there's some strategies you guys are working on to reduce promotion of SSBs in supermarkets, that would be really interesting to hear about too.
So thank you for that question. The clinic is, I believe, somewhat unique in that we do have an entire institute devoted to wellness, and Dr. Michael Roizen is our Chief Wellness Officer at the Cleveland Clinic, and we do actually offer those services in terms of how do you craft a wellness strategy for an employee group out within our community. And interestingly, the county in which we are located has 59 communities, and our new county executive is now embarking on an initiative to actually really look at the health of the workplace, both in terms of the government sector, but then looking at schools, looking at large employers, industries. So I think we will have a chance to really begin, helping groups and employers to make those changes. Speaking to the vending side and sugar SSB consumption, I think that groups haven't reached out in that way yet. I think they're still, at least in our area, are still looking at tobacco, maybe diabetes or hypertension, but I think that as from our standpoint, we would be willing to share how we made the changes or what was successful. And to your second point, briefly about the supermarket, the clinic does have a line or a kind of an endorsement program called GO, it's G-O exclamation mark, that is a labeling system that is utilized in grocery stores. And right now, we utilize, what we're very proud of is that in the Cleveland area, we have a tremendous amount of food deserts. But there is one local chain that has been around for 80, 85 years that has stayed very much a part of the community, and now they are utilizing the GO labeling in those urban grocery supermarkets. So again, it's another way.
So on the workplace wellness, we have not in Boston up to now had a really integrated, systematic approach to workplace wellness. We do have a new action plan for obesity prevention for the city called Boston Moves for Health that I want to acknowledge a couple of the other Boston-based experts in the room helped us to craft. And actually looking at workplaces and looking at healthy beverages as a key component, including water access, is something that we are going to be focusing on. Up to now, we've taken this cross-cutting approach to sugar-sweetened beverages, which is, I think, good, and it gets a lot of community-wide sort of awareness building, but the policy change kind of happens where someone uptakes it from this organization or that, and it hasn't been that systematic past the healthcare and municipal and school sector. And one thing that we found is when we have had some interest by workplaces that if they don't already have an organized workplace wellness approach, they don't quite know how to fit it in because there's no one to champion something that seems so kind of standalone as what are you going to do about your vending or your cafeteria beverages. We are very interested in working with supermarkets and, have been following the SISB work on this. And so that's an area we'd like to be exploring with other partners in. And another area where this national networking and learning from what each other is doing is so critical to being able to lift it up. So we'll see. We hope to.
I guess related to employee wellness, just to put in a plug for a product, the Network for a Healthy California, the SNAP-Ed program in California, has a really nice kit. It's called California Fit Business, and one of us here could probably get you the contact, but I think they include some SSB components in that. Related to outreach to supermarkets, we've had one meeting with a representative of the California Grocers Association who seems very interested in helping at least give us introductions to the owners of some of these chains. She recommended to us to go to the mid-size, not the real big ones, to start with the mid-size, and she said in the Latino community she listed 5 or 6 that she thought might be receptive. That I've gone into a few of their stores and they are just loaded with fresh produce that's prominently displayed, very high quality, affordable. But the SSBs were, prominent as well at the entrance, at the end of the aisles. And we've had one other meeting with a community leader in the Latino community, and through that meeting I came to realize that we'll have a much greater likelihood of success if we reach out to these grocers with the community leaders from that ethnic community rather than going in as the health department. So we're going to try to partner with them.
Just a really quick supermarket comment. I think, Jim, you're aware the politics of working with supermarkets are really tricky. I think we're still at a point in time where we're trying to incentivize markets to come in to cities like Philadelphia and other places, and now there are national initiatives to do it. And rightly so, in many ways, supermarket operators are seeing that making that commitment to urban communities is an important public service that they're doing. So to ask them to do more or to regulate them gets pretty tricky. Supermarket operators were among the first group of folks that said that the tax wasn't a good idea. And they were pretty clear about saying a huge amount of their sales and revenue comes from these products. So I think as you've been helping us think through what are the voluntary approaches that might work, what are the regulatory approaches that at least need to be considered. So it's an interesting type of partnership to develop.
Could I also just mention, you asked about supermarkets, I know, but we worked on an initiative with corner stores about 6 years ago focusing on healthy beverages. And I just want to say that was a complete non-starter because of the issue of the profit margin being so slim for these stores. And, soda and other drinks are a huge component of their profit margin. And we had great success engaging. There were about 6 to 8 corner store owners in a few lower income neighborhoods of the city. And, they were very interested in the health issue, but it just didn't go anywhere. And then we turned that effort to be more to promote fruits and vegetables and whole grains in corner stores. But so I'm not sure where it will go with supermarkets. I know they're a whole other level, but the small markets, it doesn't seem to be a strategy with much traction.
Paul, you mentioned changing social norms, and Ann, you mentioned, the access to water. Have any of you, and you've made changes and talked about in vending machines, but what have you done to really just increase access to free water so people wouldn't have to buy it? Have any of you developed like water stations or had more innovation in water fountain placement, or has it really focused more on just selling healthier beverages?
Well, we've been working with the school district about access to to water in all the buildings, and we have older schools. It is a gigantic issue that is just seems like it should be so simple, but we are running into many issues about just the logistics of it. However, first of all, it's now a requirement that water be available to all students throughout the day, and the school department is very committed to it. So that's where we put our major partnership effort up to now. But we do have a task force that is a few city agencies looking at the water issue, and we actually just met 2 days ago, and we brought in our local water authority, the Mass Water Resources Authority, and we're at the beginning of crafting a work plan of how we can do this in the city. And although we haven't done any formal surveys of this, what we know anecdotally is the perception of tap water, and Boston has some of the both purest and best tasting tap water in the country. The perception about drinking tap water is just amazing, what people say. It's like toilet water, it's from the harbor, it goes on and on. And so I think this is an issue of access and infrastructure, but it's also a huge issue of social norms and how to turn the tide on that.
I'm just thinking now, as we're talking, an ideal partner in Southern California would be our large water district. I mean, they have big budgets for promotion, and they have an interest really in trying to change the social norms around that. Like Ann's experience in Boston, I think what's happened most actively in California has been around schools, where a state law was passed requiring water to be served. Ken Hecht would know more about this, but my sense is a lot of schools have had challenges implementing it. There are some costs associated with it that are challenging.
So I think we're also fortunate. We live on Cleveland is situated on Lake Erie, just as a geography point. And so we also have a very high quality of drinkable tap water. We haven't, unfortunately, increased our water fountains in our facilities yet, but I do know in the vending machine, in the cafeterias, the little button that you can push, water from the cafeteria, from the soda dispensers is free of charge. So, and we haven't really made a water station yet, but also our cafeteria, our catering services no longer provides bottled water for functions. Only pitchers of water, crafts of water are provided. So that's a good step.
Ken, I think you had your hand up.
Oh, you asked the question
already. Good morning. My name is Matthew Lindsley from the Horizon Foundation in Columbia, Maryland. We're curious to know, those of you that used a media campaign, how much was your budget? And did you do some qualitative measurements, such as a focus group, to kind of test messaging?
So we did do formative evaluation, trying to understand trying to understand better our target audience and how they think about sugary drinks, what their behaviors are at baseline. We developed messages and then did message testing to see how folks would respond. And then, as I showed you, we're doing some evaluation as well. One, to make sure that people are actually seeing the ads, and two, to make sure the sort of knowledge, attitudes, and behaviors are moving in the right way. We devoted over, 2 years, about $2 million to the media campaign in Philadelphia.
In Los Angeles, we invested with some national support about $1 million in our media campaign, and it was informed by focus group testing, and it was really important because in our jurisdiction, I'm sure in many others, there's such diversity and different perceptions. And one kind of interesting experience was that as we shared the various options with our leadership in our department, they had very strong feelings about what they liked, and it didn't jive with what the community liked. And we had to work hard to convince the leadership in our department that we got to go with what the community responds to, not what the leadership of our department responds to. The other is that we learned how somewhat minor changes can make a big difference. For example, at the bottom of our material where it talks about how excess consumption of SSBs can lead to heart disease, diabetes, obesity, by simply adding the word cancer. We saw an incredibly increased response, and so we really struggled over that one. Is the research strong enough really to add that? And in the end, we decided there was enough evidence out there that at least there's a multi-step progression from excess consumption of SSBs to cancer. And so I think that the take-home our communications manager would, I'm sure, emphasize this, is that you have to do the formative research to inform your campaign for the audience that you're serving.
So in Boston, also with federal funds, we spent, I think, about $1 million on the two campaigns, Fat Smack and the Parent Protection Campaign. And we, well, I just want to say, I think the work that's been done by a number of communities, and actually Philadelphia did great formative research, which they then made available to others too, which we appreciated. There's not a huge body of literature yet on the campaigns in this area. And so that was challenging. And I think everyone sharing their research and on the campaigns that are being done now is very helpful to the national effort. So we did some focus groups in terms of formative research, and then after we developed, we had a few model, ad concepts for each. We did some on the street intercept interviews to get feedback. Youth focus campaign, Fat Smack, was actually developed by a youth media council that we had, and there was a lot of internal conversation about that because none of the adults liked the idea of the fat coming across and hitting the kid in the face. And but it got great youth response. So again, know your audience. In fact, it got such great general response that we changed the media mix that we had bought in order to put some of the Fat Smack on some of the more mainstream TV where we had only been going to do the parent campaign to begin with. What came across very clearly in focus groups with parents was this idea of wanting to protect your children, and this idea of being very respectful of parents' desire to really do right by their children, and how to message that with, but there's something that you may need to be changing about what you're doing.
I think we have time just for one more quick question or comment.
Hello, my name is Brianna Morrison, and I'm with Community Health Councils. We're a South Los Angeles-based community organization. And my question is actually directed towards Dr. Simon. Hello, behind the tree. I'm sure you're well aware of the work that the Center for Public Health Advocacy has been doing to sponsor statewide legislation about a soda tax or a sugar-sweetened beverage tax. And even though it hasn't been passed yet, it's definitely been instrumental in sparking discussions statewide and also locally about the possibilities of a tax on sugar-sweetened beverages. And I know the city of Richmond, actually their city council is considering a ballot initiative to impose a sugar-sweetened beverage tax. So I was wondering, in LA County, what initiatives are taking place, either regionally or with city municipalities, to discuss the idea of a potential sugar-sweetened beverage tax? Thank you.
Yeah, I should have mentioned Community Health Council is one of our community partners that's been a great leader. And yes, there is interest in LA County, and I think we should probably talk offline, but there are several cities and even one person here from a city who we'd be glad to hook you up with. And then I'm even getting now some inquiries from some county offices as well. So again, that would have been unheard of a few years ago, and now we're seeing some interest, and I look forward to actually talking to Philadelphia and a few others about what sorts of information can be most persuasive to build the case.
Well, I would like to thank our panel once again for sharing their stories with us and really motivating all of us.